As you may recall from the anatomy lessons, the coronary arteries are the vessels that supply blood to the heart. And there's the right coronary artery and the left coronary artery. Coronary artery bypass grafting surgery is the most common type of open heart surgery in the United States. It is conducted to treat those with coronary heart disease to improve the oxygen-rich blood flow to the heart.
Coronary artery bypass as an open heart surgery have to access the heart. For that, the sternum is cut in half and spread apart.
During coronary artery bypass grafting surgery, a healthy artery or vein from the body is connected, or grafted, to the blocked coronary artery. The grafted artery or vein bypasses, that is, goes around, the blocked portion of the coronary artery. This creates a new path for the oxygen-rich blood flow to the heart muscle.
A graft is a piece of living tissue being surgically implanted. In this surgery, a piece of blood vessel is taken and inserted above and below the blockage of the artery to provide a new and unobstructed path for blood flow. A vein graft is usually taken from the leg. An artery graft is taken from an artery in the chest or in the arm. Tubes called cannulas are put into the right atrium and into the aorta to pump blood out of the heart into a heart-lung machine. The heart-lung machine, or pump, takes over the function of both the heart and the lungs. The blood is pumped out through the venous cannula, oxygenated in the machine, and then pumped back into the body through the arterial cannula.
Coronary heart disease is caused by the obstruction of coronary arteries by plaques, which are fatty deposits which prevent efficient blood flow to the heart. As the plaques grow and grow, they may cause inflammation and narrowing of the arteries. In order to recover the blood flow to the heart, coronary artery bypass grafting or coronary artery surgery is conducted.
There are several ways to perform this procedure, but the most common coronary bypass surgery is called Lima-Rima, or Lima-Rima, in which the left internal mammary artery and the right internal mammary artery are used to connect with the coronary artery that is blocked.
In order to sew the grafts onto the very small coronary arteries, the heart must be stopped to allow the doctor to perform the very delicate procedure. Tubes will be inserted into the heart so that blood can be pumped through your body by a cardiopulmonary bypass machine. Once the blood has been diverted into the bypass machine for pumping, the heart will be stopped by injecting it with a cold solution. When the heart has been stopped, the doctor will perform the bypass graft procedure by sewing one end of a section of vessel over a tiny opening made in the aorta, and the other end over a tiny opening made in the coronary artery just below the blockage. If the internal mammary artery inside your chest is being used as a bypass graft, the lower end of the artery will be cut from inside the chest and sewn over an opening made in the coronary artery below the blockage.
You may have more than one bypass graft performed, depending on how many blockages you have and where they are located. After all the grafts have been completed, the doctor will examine them to make sure they are working. Once the bypass grafts have been completed, the blood circulating through the bypass machine will be allowed back into your heart, and the tubes to the machine will be removed. Your heart will be restarted. Temporary wires for pacing may be inserted into the heart. These wires can be attached to pacemaker, and your heart can be paced, if needed, during the initial recovery period. Some goals of coronary artery bypass grafting include improving your quality of life by allowing you to resume a more active lifestyle, lowering the risk of heart attack, and increasing your chance of survival. reducing angina and other coronary heart disease symptoms, improving the pumping action of your heart if it has been damaged by a heart attack.
Risks of this operation include, but are not limited to, bleeding during or after the surgery, infection at the site of incision, or cardiac arrhythmias and dysarrhythmias. It's time to heal. The results of CABG surgery are usually excellent. The operation improves or completely relieves angina symptoms for most patients. Although symptoms can recur, many people remain symptom-free for as long as 10 to 15 years. Coronary artery bypass grafting also may lower your risk of having a heart attack and help you live longer. You may need repeat surgery if blockages form in the grafted vessels or in other coronary arteries. Taking medication and making lifestyle changes as your doctor recommends can lower the risk of a graft becoming blocked.
It is important to state that a short-term angina reduction occurs in 95 out of 100 cases, a long-term reduction in a 5-year period in 80 out of 100 cases, and the need of another surgery is only 2% in a 5-year period and 7% in a 10-year period. Coronary artery bypass graft is not a cure for coronary heart disease. Lifestyle changes will help you and your heart to stay healthy. That is why you are here, to get better and to get your heart better.